One Health is a concept that helps us understand how humans and the environment and animals all interact on planet Earth. So the way that we can really bring these together is to think about how is it on a daily basis a human being may get in touch with or interact with these different elements. So a very good example is that everyone has to go outside about their daily lives and they'd be breathing in the air. So air is an environmental factor, part of One Health. Another component might be rainfall. We could also think of it as extreme weather, all the things that happen on Earth in the environment and how we as humans interact with it. Then we've got animals. So you might think that animals only live in the wild, but of course animals are all around us. So for example, the birds that live in our communities and the parks near where we live. If some people live in rural areas, they may have farm life like pigs, cows, and chickens. And our interactions with these animals means that we can transmit either from human to animal or animal to human health conditions. So this might be something like, for example, bird flu or avian influenza. And this is how when we think about One Health, we have to think about where humans are in the environment in relation to animals and how we may connect with each other and therefore influence the health outcomes of both humans and animals. It can also influence the environment. Using One Health is a really good way to conceptualize how we may better deal with preventing adverse effects or impacts on human health. So for example, when we have an outbreak of a type of swine flu, which comes from pigs, we would then want to protect humans from the exposure to pigs or products from pigs. And that means we eliminate the interactions between the two. A good example of One Health and a way that we'd want to think about in the future is for pandemics. So for example, in the COVID-19 pandemic, we saw the emergence of this infection. We didn't know where it came from. It spread all around the world. And when we looked back to where it started, it was because, and this is still of course under debate, but it was because something that had lived in an environment not in contact with humans, was brought into what we call a wet market, or a market where people go in and buy products or produce that has not been processed in any way. It's really in its raw natural form from the environment. And unfortunately, this product that was in this market was infected with the germs or the bugs that then led to this disease going into humans and unfortunately crossing across the world. So if we apply a One Health approach to thinking about this, we have to think about what could we do in the environment to keep it safe, keep those animals in their homes, in the environment, and not bring the animals into closer interaction with humans. It doesn't mean we should be afraid of animals. We love animals and we love the environment. We need to protect everyone. But from a health perspective, we want to make sure that we look after both humans, the environment, and animals.